everyone. Today is World Sight Day. This is the day where we are being reminded to think about our vision and to be aware of medical conditions that actually affect our sight. And I always reflect about my patients, especially those patients who come to see me as a doctor and they're well advanced into the disease, or their vision is very severely affected. And I think about it, I look at them, and as they're getting onto my chair, I look at her and I think, I wonder who chose her shoes. I wonder who chose her dress. Does she even know when they say red, what type of red is it? Is it a deep maroon red, or is it just a normal blush type of a red? I mean, I think about it and I'm always like, we take it so for granted, how much power of choice, vision and sight gives us. Think about it, crossing the street. We do it without giving it a second thought. But to look left and right and left again, or whichever way you look, to see the car coming, you need to have sight, And so we really need to take care of our vision. And this brings me to my second point today, talking about sight, is that, whenever a doctor tells a patient or tells you as a patient that you have this eye condition, it's important for you to think to yourself, did I understand exactly what the doctor explained? And if not, can I say to the doctor, please, may you write this condition down so that I can go home and research about it and read about this condition so that I know and I understand what it means for me to have a ptosis. What is a ptosis? Ptosis is a droopy eyelid. Does it affect my vision? Does it affect the vision of my child if my child has that? So, you need to be proactive in knowing what is happening with your eyes. So, having said that, I have, drawn up about 7, symptoms or 7 things that a person can experience in their eyes or with their eyes that could be a sign of danger, that something is wrong. Okay, and should not be ignored. So the first sign is loss of vision. When your vision goes down. Okay, so when your vision goes down, it can be fast, it can be slow, it can be just, in spots, in places, certain places where it's not clear and so forth. And so you need to be aware of it. If you notice that, my vision tends to disappear, when I look this way or that way, I can't see, this part of my vision. I can only see the central parts of my vision. That is not normal, especially if your vision goes like that. If your vision goes like that, you need to be even more scared. Don't wait and say, maybe it'll come back in 2 days. No. You go today to go see a doctor if your vision disappears like that. The second sign is a red eye. We have all experienced red eyes, whether we get a splash in the eye or something. But a red eye that is not going away is a dangerous sign. Okay, and you may think, what is going away? If a red eye is not disappearing within 2 days, there's something wrong. If a red eye is associated with decreased vision, there's something wrong. If a red eye is associated with pain, there is something terribly wrong. You've got to think about it, and you need to go to see your eye specialist or your GP and say there's something wrong. Red eyes that are itchy from, allergy, or red eyes that's associated with the watery discharge, some people could be like, fine, but red eyes should just not be ignored. And then the third sign is discharge. A discharging eye is not normal. I don't know how to stress this even more. Okay, so some people will say, I've got a watery discharge, maybe it's just allergies. Could be. Or it could be that you've got a viral conjunctivitis. So you've got an infection of your eye caused by a virus. Okay. We all know about the pink eye, the contagious one where it goes from one person to the other. That can present like that. But then there's more dangerous signs of a discharge. So a white discharge, a greenish discharge, bad sign. That means you've got a bacterial conjunctivitis or something else is happening. You need to go and see a doctor, okay? You've got a bacterial conjunctivitis, and if it's gonococcal, which is a very, very, very bad infection, that could eat up your eye. So a green discharging eye is not a good sign. And then, as I've already explained about pain, there's nothing like pain to drive a patient to the door, to the doctor's door. A painful eye is not normal, you know, and it may be a sign that the pressure in your eye has gone up, there's infection, there's something wrong, and you need to go and see your doctor. Then the other sign is swelling. If your eyelids swell up, okay, and I'm talking about especially those eyelids swelling up where a patient has had like a runny nose, a sinusitis or something, especially in kids. It happens a lot. They get like a runny nose, a sinusitis, and all of a sudden the lid starts swelling up and then the vision is going down. I mean, that's a terrible sign of a condition we call orbital cellulitis. That is actually an emergency, okay, because it can lead to all sorts of complications. One day we'll have a show about orbital cellulitis and we'll tell you all about it. So swelling eyelids are not a good sign. Then I think this is the sixth sign. The sixth sign or symptom is an eye not moving normally. Okay, so when I say your eye's not moving normally, usually you look to the left, you look to the right, you look up, you look down. This is how your eyes move, right? We all do it. But if, for example, your eye moves everywhere, and then all of a sudden, when you're trying to move to the right, it does that, and this eye is still, there is something wrong. If your eyes are not moving together, it's just your abnormal eye movements are not to be ignored, especially if you've been having normal eye movements. Don't think to yourself, it might come back and be normal. Don't do that. Don't do that. Go see your doctor. And then the last sign is swellings on the eyelids, okay? Symptom is swelling on the eyelids. I left this to last because there are many people who get like little minor swellings around their eyelids, okay? That could be from like a blocked gland in your eyelid, which is okay. But then in white people or Caucasian people, some develop like growths on the eyelids, and those growths could literally be cancer. Okay, and so then those growths need to be dealt with. Don't ignore it and say, it'll go away. It's just a pimple. You need to go and see an eye specialist. So with these 7 signs, what I am saying is that we need to be more proactive in our health-seeking behaviors, in the way we seek help or the way we respond to symptoms that we are experiencing about our bodies. We need to become more and more proactive about it. Yes, it may cause doctors to work more, but at the end of the day, it's your health, all right? And it's your vision. Oh yes, and I forgot. Actually, on the growths. Oh wow, how can I forget about this? Some people get growths on their actual eyes, like over there and over here, like right there, okay? And if you get a growth on your eye that you don't understand and it's growing in size and it's actually changing in color, it may become a bit irritated, that growth might be a start of cancer, okay? So I'm not saying all growths on your eyes are cancer. No, that's not what I'm saying. But what I'm saying is if it changes in color, it grows in size, and it's just looking abnormal, do not ignore it. Go to the doctor. It's better to cut that little growth out earlier rather than later, or it grows and eats up your whole entire eye, and then that's another story for another day, okay? So yes, before I forget, yes, that's a very important thing. So yeah, because I must say I have seen patients who have presented to us with those eye growths. Actually, that's one of the reasons why I actually even started the show, where they have these eye growths, and these eye growths keep growing and growing, and then the patient comes back with this big tumor on the eye, and then you end up having to take out the whole eye and the eyelids and everything. And you think to yourself, had this person come to me 3 months ago, this growth that had been this small on the eye, would have just cut it out, treated them, and would have saved the eye. Now the person has lost their eye because they waited too long. Why? Because they were scared. We're all humans and it's normal to be scared, but don't allow fear to keep you away from seeking help or going to your doctor. Okay, so with that, I want to say that happy World Sight Day, and we are always here to help you as ophthalmologists. We are here to help. So with that, I am Dr. Tebz, putting your health back into your hands.